a fixture for about the past year has been an update on Imperial County goings-on, primarily focused on COVID-19. And, today's no different. Today, with us on the telephone, socially distancing, it's Imperial County Chief Executive Officer Tony Rouhotas and Imperial County Public Health Department Director Janette Angulo. Good morning, Janette. Good morning, Chief.
Good morning, Carroll.
Morning, sir.
It's another beautiful day, and we're going to enjoy. Okay, I see by the numbers, the magic numbers, more than 100,000 individuals in Imperial County have so far been vaccinated. Not all of them with the double dose, but we're getting there, aren't we?
We are getting there, Carol. Total doses administered, first and second doses. We did the update this morning, 103,747. So that is amazing. That is, reflective of the work that our vaccine providers are doing and our community and the response to the effort. So it is great.
Okay, and I should point out, I have been, along with many others, not real thrilled with the state of California and their My Turn website. Well, apparently, 2 months in, they do have it working now. So it is there, the My Turn website from the state and vaccinefinder.org. Two great ways for somebody that wants to get vaccinated to find out where they can.
That is correct, Carol. So yes, myturn.ca.gov. It's a way to, register, look for vaccine, and then register for an appointment. Vaccine Finder, like you mentioned, that too is a great tool. But let me tell you, if someone doesn't have access to a computer or the internet, they can also call 833-422-4255, and that is also through My Turn, and they'll get assistance. They'll get someone on the phone to help you make an appointment. So there's a few different ways in getting an appointment. Also, if you've noticed, last few weeks, local providers are accepting walk-ins. So walk-ins and appointments, either way works.
I was not aware of that. I was going to ask about that because I do know walk-ins in some parts of particularly California have been underway. But as you say, there are some providers. And I would suggest that from experience, check with Clínicas de Salud, check with your personal health care provider, check with the various pharmacies and find out who has the vaccine and either make the appointment or find out they might be able to allow you to just walk in.
Yes, that is correct. And access points in Imperial County, we have over 30. If you go to Vaccine Finder, you'll plug in a zip code and it'll show, who in that area has a vaccine, whether it's a pharmacy, a community clinic, the hospital, the public health department. And it'll also show, is it Moderna, Pfizer, is it Johnson & Johnson? So quite a bit of activity out in our community, quite a bit of access points. And let me tell you, the public health department is going to add some additional travel clinics in the upcoming days. So something to look out for.
Okay, and that is where you go out into the community and kind of do a drive-by clinic, right?
So over the last month, there's different strategies that have been implemented. Now that it's getting warmer, we are out in the community, but we are in different kinds of sites. We're at community and senior centers. We are at schools, churches, and many other types of sites. Earlier on, maybe January, February, March, we were still doing, clinics at parking lots and, out in the field where crops are growing in the sheds. So our strategy has shifted a little bit, again, just because of the weather, and it's just getting a little bit harder. And it's hard for staff and our community. We don't want them standing outdoors in the heat.
Well, we're looking for triple digits today and tomorrow, so that is perfectly understandable. We adapt. And okay, let's talk Johnson & Johnson. And I don't mean Band-Aids, but it has been cleared to use the Johnson & Johnson vaccine, right?
That is correct. And it was last week, and FDA and CDC recommended that the pause be lifted in Imperial County. We actually have a clinic this morning over at our Department of Social Services, and the morning was Johnson & Johnson. That's the vaccine that was going to be used, and we have other providers that also started providing the vaccine out in our community.
And, of course, an advantage to the Johnson & Johnson, it's a one and done.
Absolutely, one and done. Pfizer and Moderna is 2 doses.
Okay. And for people that are concerned, okay, what happens? You schedule an appointment for your first dose of Pfizer or Moderna. And so what about the second dose?
What about the second dose? That's a great question. So if an appointment is made through My Turn for the first dose, automatically individuals get an appointment for their second dose. And they will get reminders via text or via email about their upcoming second dose appointment. The Public Health Department, what we've done, because many of our county residents for the first dose, they've gone elsewhere out of county to get their first dose. We have second dose clinics, and anyone can, stop by and get their second dose so that they don't have to travel out of county to wherever they got the vaccine. So we're just trying to find ways to make it easier and more convenient for our residents to get that second dose.
Okay. And are you running into much resistance? My daughter lives in Omaha, and Nebraska is declining shipments because a large part of their population doesn't want to get vaccinated. Are we running into much of that? I know you're going to run into some of it, but has it been a particular issue?
There has been a decrease in demand here in Imperial County, and we started noticing that about 2-3 weeks ago. And so yes, there are concerns, and we understood that from the beginning. Some people are concerned about side effects. Other people, are just waiting just a little bit more so that they can, see how, people are reacting to the vaccine and before they can actually get the vaccine. Some are nervous. Some just want more information, and that's, great. That's perfectly fine. There's information out there, to help answer your questions. But make sure you get the information from a trusted source.
Exactly. The internet is, unless you know exactly where you are, may not be the most trusted source of information.
That is correct. So, CDC, FDA, California Department of Public Health, local health department, there's plenty of information there for our community to find out a little bit more about, vaccine safety, the safety monitoring after vaccination, the benefits of getting vaccinated, and much more. Okay.
And we have noticed, after a brief spike, the number of active COVID cases appears to be dropping again, and hospitalizations nowhere near what they were before.
You're right. And if you remember, there was 1 week of worsening metrics, and that was attributed to the first week of April. But after that, our cases have been declining, so our case rate is much lower. Our testing positivity is much lower, and I'm looking at the positive cases by collection date right now in our dashboard, and they just keep declining. So that's the trend we want to see.
Okay, and you mentioned testing. Testing is still a very important part of the fight against the virus. And, again, we'll go back to what we've been saying from pretty much the beginning. We need more negative numbers to be positive.
That is right. And testing, yes, testing continues in Imperial County. We have the Brawley site over at the Senior Center, and then we have our mobile unit. It's still active. We are out and about in El Centro, Calexico, and other parts of our community. And let me tell you, although we're not reaching the 85% goal of utilization that the state has for us, we are among the top, that are utilizing this resource. So we continue to test out in the community, and this is just through the mobile unit. There is testing going on at medical provider offices and hospitals. So yes, testing is an important piece to all of this.
Okay. And earlier you gave a phone number for somebody that may not have a computer, may not have internet availability for the My Turn site. Can you run that phone number by me again?
Yes, of course. 833-422-4255.
Okay. And that's toll free. So, if you are, how do we put this? If you are digitally challenged and not conversant with the internet, pick up the phone, and no doubt you have a rotary dial on that phone, and call, right?
That is correct. Or call the local health department as well, and we'll be more than happy to help you.
Okay, and I can't begin to tell you how many people Tracy has helped, navigate the system as well when they call here. So it's there. Okay, let's turn our attention to the chief, the chief executive officer, Tony. Good morning, Tony.
Good morning, Bob.
Okay. A couple of quick questions about things that are happening in Imperial County. How's the Nyland situation these days?
So we're actually working on a large project. Are you talking specifically after the fire?
After the fire.
Yeah, so we actually have some grant funding that we're exploring right now for the long-term housing. As you're aware, after the fire, we had several dozen families that were left without housing. So we did some short-term housing, redirectional housing, where we got people into apartments or additional rental units. Now we're actually working on the next phase, which was the longer-term phase of obtaining grant funds for replacement mobile homes. And some of that is coming down the pipe right now, and we're working on that. We're going to be scheduling some hearings to be able to direct the grant funding in the appropriate way. So it's something that is coming up in the next couple of weeks, so stay tuned. We're definitely looking for a positive impact with that occurring and being able to attain that money, because it's extremely important to get those families back into the communities. And, the other side is we just also began opening up a new fire station that was also under construction, which is a huge positive for that community as well. They have a new state-of-the-art, beautiful facility that houses both fire and the sheriff's office substation up in Nyland. Okay,
and I know there are a number of the joint use facilities, some that even include a meeting and civic center type approach.
Yeah, sure. Great point. In some of our rural areas, our rural communities, our townships, power outages are something that occur frequently here, especially during the summertime. So this is equipped with a cooling center as well. It's a large open area that can be used for multiple applications. But the main application for this was to have a cooling center in the event of time of emergency, where we could get people that are without power for long term, especially during our hot summer months, to be able to go and cool down during the day.
Okay, and speaking of housing, there are at least 2 facilities in Imperial County that the state has contracted with to house undocumented. Are these family units? Are they kids? Are they adults? Can we clarify some of that?
Yeah, so there's a little bit of both of all the groups you mentioned. The two facilities are the Ramada Inn at Barberworth Country Club and the Travel Lodge over, I believe it's on is that Ocotillo over by Imperial Avenue. The state has contracted with both of those facilities. There was some questions in the press and by some of our local leaders the last week if we were going to be receiving TOT taxes on there. So I'll just let know that we have been in discussions with the state, and the state is paying all applicable taxes for the utilization of those rooms. I don't know exactly the contracts directly with the state and the owners of those facilities, so we don't know exactly how long this is going to last. But they are prepared to help facilitate these transitions for the people migrating across the next couple months.
And how might this be impacting local services? The county, I know you can't answer for the city, but is this impacting local services?
So we are keeping a pulse on that. And part of the reason the state is here is because I made it very clear that this county cannot take an impact either fiscally or staff-wise to deal with another situation. So very early on, we made it clear that the feds needed to link up and work directly with the state. We are available to provide local wraparound services, whether it's behavioral health, social services, or medical. However, we're not taking on the fiscal liability with this operation. I will tell you, we have not seen a huge increase in demand for any of these services, but we are prepared and we are at the table to address any of the needs as they come around.
Okay. And what else is exciting in the county?
I think just something I wanted to bring up. You're going to see the messaging, and it goes back to what you and Janette were talking about a little while ago on the hesitancy. Janette mentioned, we've vaccinated over 100,000 people. We've also held 150 clinics just as the county. So I think that's extremely important, and that's going to be included in some of the new messaging coming out. Because with that many, the majority of our population, when you look at the population, when we're thinking of 188 or 190,000, whatever you want to call it, however, the population that's been inoculated at 103,000 is a much higher percentage when you really look at it, because 16 and under are not eligible for the vaccine. So I think it's just a true kind of stamp where we are. And I think, I don't know if Janette mentioned something the other day, we are on the upper tiers of percentages of inoculations occurring throughout the state. So kudos to her and her team, because there's a lot of work going on out there to get that done. The messaging will continue, and I think it's extremely important. Of course, not everybody's going to get the vaccine because they're just not going to want it. We truly appreciate and understand their stance, but we definitely want to get it to the ones that do want it.
Okay. And you mentioned work. Are we any closer to county employees returning to their offices?
Yeah, we actually hosted a department head meeting on Tuesday, and I've been having the department submit a staffing plan. The staffing plans is we're really headed back to normal with bringing staff back that have been telecommuting, opening up services that were remote for in service. So that's taking place, and it's happening. We're making things happen.
Okay, we're moving in that direction. And Janette, the governor says, May 15th, was it? June 15th.
June 15th, beyond the blueprint. That's when that'll happen.
Okay. And that doesn't mean don't wear a mask and don't socially distance. It means be smart, but let's start returning to normal, whatever that is.
Yes, and even without a blueprint, the local health department will continue to monitor. We have our surveillance projects, and most definitely, if the situation starts to worsen, then yes, action will need to be taken. So stay vigilant, wear your mask, get vaccinated, so that, yes, we can return to our normal.
Okay. I'm still trying to figure out what normal is. So it's just one of those things. It's been a while. We appreciate the visit today, and we appreciate the update. And again, if you have some hesitancy about the vaccines, do research, but use real resources, as you mentioned, the CDC or the State of California Department of Health, or call the Imperial County Public Health Department, or go on their website and you get the information, right?
That is correct. And the local health department's call center number is 442-265-6700.
Okay. And remind everybody, coming up next week, Cinco de Mayo, and followed by Mother's Day, which will be Sunday and Monday. Be safe.
Be safe and stay vigilant.
Okay. Tony Rouhotas, Imperial County Chief Executive Officer, and Imperial County Public Health Department Director, Janette Angulo, we appreciate the visit today.
Thank you, Carol. It was good talking to you.
Thanks for your time, Carol.
Always a pleasure.
The best oldies on the radio.
Imperial County Air Pollution Control District provides you with air quality reports daily. How is your air quality today? Check current air quality conditions in Imperial County at imperialvalleyair.org. You can sign up for free air quality alerts to be delivered directly to your email address, or you can download the Air Quality Alert app to your mobile device today. Stay informed with Imperial County Air Pollution Control District.